What's all the hype about Kratom? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist, and I've gotten a lot of comments on this app about Kratom. What is it? Saying that it's the best thing for their mental health or that it's more dangerous than illegal drugs like cocaine and heroin. So let's set the record straight. So Kratom is an herbal supplement that comes from a tree in Southeast Asia, and its active chemical works similar to opiates, stimulating the opioid receptor, so it can also have a pain-relieving effect. Now, sometimes people actually use this to help with opiate withdrawal, as well as a number of other indications, things like anxiety, depression, coughing, diarrhea, and others, although there's not a lot of evidence to support these uses. At lower doses, it has a stimulating effect, so people sometimes use this for an energy boost or help with their concentration, while at the higher doses, it's going to have that opioid-like effect. Now, people often think that this is safer than other street drugs because it's readily available, it's not illegal, you can get it at a gas station or smoke shop or convenience store. However, there are significant risks associated with it. One, due to the fact that it's not at all regulated, and two, due to the fact that it acts similarly to an opioid, and so it can have similar risks. Some side effects of Kratom include things like nausea, dizziness, hallucinations, agitation, shortness of breath or kind of reduced respiratory rate, liver damage, and even death in some cases. And long-term use has also been associated with things like dependence and withdrawal, just like opiates. Now, there can be increased risks associated with certain conditions. So those who have alcohol use disorder are at increased risk of suicidal thoughts, and those with a history of epilepsy are at increased risk of having seizures. And those who have history of mental health conditions or cardiovascular conditions can experience an exacerbation of these. Of course, the thing that we worry about most with mental health conditions is going to be the risk of suicide. There can also be concerns related to interactions with other medications. So Kratom is metabolized through the liver through the CYP P450 system. So other medications that get metabolized through the same enzyme system, their availability and effect can be affected by Kratom. Also, Kratom tends to be sedating, can slow your respiratory rate. So there can be a compounding effect with other sedative medications. And then also there is an increased risk of things like serotonin syndrome when taken in conjunction with other serotonergic agents, things like antidepressants, certain pain relieving medications, and even certain antibiotics. Now, although Kratom has been banned in certain states and other countries, and the FDA has warned against its use due to the risks associated with it, it's still readily available, and there's still this thought prevalent that it's not as risky because it's legal and easy to get. So hopefully this provides a little bit of clarification on the Kratom issue, but if you have any questions or comments about this, please feel free to put in the comments below. Wish you all good mental health today, and I'll see you in the next one.